Welcome to the Patient Educators Update, where we focus on patient education and patient education topics in a clinical environment. My name is Chuck Jones with Synergy Broadcast, and I'm happy to welcome our guest today, Fran London. Fran is a patient education specialist at Phoenix Children's Hospital out in Phoenix, Arizona, and she is also an author. She's written numerous articles and 2 books. The most recent book is No Time to Teach, which has been voted the 2010 Book of the Year by the American Journal of Nursing. Hi, Fran.
Hi, Chuck.
How are you doing today?
Good.
It was over 100 several times over the weekend here in Texas. How about in Phoenix?
Same here.
Yeah. I know the folks up in the Midwest and the Northeast are struggling with these hot temperatures. They're not used to it like we are, but it's no fun even down here, is it?
It seems worse every year.
Yeah, I would agree. Well, we have an interesting topic today. We have decided to go back to January 4th of this year, and you wrote a very interesting article titled, "How Do I Improve Patient Education in My Organization?" And you may have forgotten about that article, but it was fairly lengthy and very meaty, gave a lot of interesting tidbits and recommendations to folks that may want to do something, make some changes in their hospital. And so I thought it might be appropriate that we take a look at that topic today, because it's always good to step back, look at what you're doing, and see if it's time to change perhaps. So are you ready to dive in?
Okay.
All right. Now, one of the things that you mentioned right at the outset of this article, and by the way, we'll put a link to this article in the show notes so people will be able to click on it and read the whole thing, and I recommend that. But you mentioned 3 things in the very beginning. You talked about the importance of infrastructure, training, and accountability. Can you kind of top line these and tell us why these are so important?
Sure. I think because my focus is no time to teach, that we always complain that there's no time to teach, the best way to take advantage of the time you do have is to have everything in place so you can be efficient. Mm-hmm. And the first thing is infrastructure, having everything you need there, ready to go, the tools that you need to teach with, maybe policies that tell you what needs to be taught when, by who, and job descriptions that say that teaching is expected. And what was the second one?
Training.
Yeah, you can't hold people accountable unless you know they know how to do it. So you want to make sure that they know how to teach. You can't assume that people know how to teach, because it is a skill. It's not a complex skill, but it needs to be taught. Okay. So make sure people know how to teach. And then accountability, that's the most important, actually. If you don't tell them it's expected, they might not do it.
Yeah, that makes sense. There's a saying that we have in our business: you can't manage what you don't measure. And so you have to pay attention to things in order to be able to kind of move forward with them. Well, now, let's talk first about infrastructure. You talked about having policies and having things in place. Can you give us a little bit more detail on how you see infrastructure and what's necessary to build a good foundation for patient education?
Well, one of the things is having the teaching tools available and making sure everybody knows where they are, what's available, and how to access them quickly. That would be handouts or videos or flip charts, whatever it is that you use to support the teaching.
Okay. Now, one of the things that you mentioned was making sure that your teaching tools are standardized and easily accessible. Now, as I think about standardization, I think of the same thing everywhere, but in a hospital where you've got a lot of different departments, what do you mean as standardized? Does that have something to do with where they come from or how they're used or sources? What does standardization mean for you?
Some of that could be in the policy. So the policies would define how things are standardized, whether you're buying your teaching handouts from a company and they're online so everybody could access them, or if you're creating your own, perhaps sharing them in the intranet that you've got, so that if you have a patient with a diagnosis in two different places in the hospital, they could both access the same teaching materials.
Okay. Could standardization also perhaps define your sources? Like if you're going to do your own, and more than likely you're going to use the internet for some of your sources, you probably need to document that so it can be at least double checked or looked at by other people. Does that make sense?
Exactly. For example, one of the things my hospital does is if we link to a resource from our website, then that means it has been checked by the experts as an okay thing to send patients to. So if it's on our website, it's okay to use for teaching. That's in the policy.
Okay. All right. One of the next things we talked about, or you talked about in the article, was training. And as a subset of training, teaching skills and measuring staff competency. Now, how do you do that? If you've got hundreds of nurses working different shifts, reporting to different people, how do you manage that?
Every hospital has its own system for doing this. It might be general for the entire hospital where they have standard skills labs that everyone has to pass every year, or perhaps each area has its own competencies for their specialty. Whatever it is that you do, there's a way to do it for patient education also. Basically, the major skill in patient education that needs to be tested is teach back. Do people know what teach back is? Do they know how to use it effectively? And do they know how to document the results of the teach back?
Okay, and I guess one of the best ways to measure that would be to follow the nurse educator around from patient to patient and actually see how they do it.
That really is a most effective way because it's real life situations.
Now, one of the things after teaching and training is documentation. How and what should one document regarding patient education?
I like to think about documentation as being a tool for interdisciplinary communication. Basically, one shift to another, one profession to another, talking about what the status of teaching is and where we're going with it and what the assessment of the learner is and what their skills are so that everyone can teach efficiently. In my hospital, what we document primarily is the results of the teach back. Mm-hmm. So our documentation has how well did the learner understand this, and so it's just check boxes after that.
I got you. Now I'm going to ask you a bit of a loaded question because I have a story for you. What good is the information that's documented if no one looks at it? And the reason I asked the question, I'll tell you a quick story. When my mother was in the hospital back in January of this year, I think it was the second day that we were in the hospital, a psychiatrist came in, and he introduced himself. And to give you a little background, my mother, before she passed, has had Alzheimer's for a little bit more than 5 years, and it was fairly advanced. She was also very hard of hearing, so communicating with her was fairly difficult. And we noticed that when she was in the hospital, she suffered sundowners more than not. And for those that are not familiar with Alzheimer's, sundowner syndrome is towards the end of the day when Alzheimer's patients get kind of super confused and super agitated. And hospitals tended to bring that out in her. But anyway, she was there for another problem, and the psychiatrist came in and introduced himself, and I asked him why he was there because we were not told that he was going to be coming. And he said, well, I was told that your mother was a bit confused and I wanted to come in and see if I could help. And I said, well, she has Alzheimer's. Are you aware of that? No, I wasn't aware of that. I said, did you look at her chart? No, haven't looked at her chart. And I said, well, she has Alzheimer's and is fairly advanced, so that's why she's confused. And so he said, well, do you mind if I talk to her? And I said, no, help yourself. Just understand she's very hard of hearing. And so he did what a lot of other people do. He talked to her in a normal voice, and she didn't understand what he said. And she looked at him kind of confused and said, I don't understand you. Would you talk to Chuck? He'll tell you whatever you need to know. And so, he comes back to me with a couple of more questions, and I said, well, really, all of this is in the chart, and I'm really not sure what you can do. I said the best thing for her once she gets treated for why she's here is to be released and get back in her environment. Then the confusion goes away. And so that's kind of my story of the documentation is wonderful, but if nobody reads it, then what does it do? It wastes a lot of time, and that's what you're all about.
Yeah.
Let's don't be doing that.
Exactly. And then you wonder if the people who don't look at the chart also don't document because they assume no one else looks at the chart.
Yeah, and therein sets a terrible precedent because, as we've talked in the past, there's going to be a lot of money spent on electronic medical records with the objective to make all of the medical records almost portable, if you will. And if documentation will suffer because nobody thinks they're going to read them, then it's a lot of money down the drain for nothing.
Exactly.
Okay, well, that's enough of my soapbox for today.
It's a good story.
Yeah, I appreciate that. It's the true ones are always the best ones. We've been into this about 10, 12 minutes. I think there's 3 more questions. I think let's just keep marching on. And if this turns out to be too long, we'll go ahead and break it up into 2 segments.
Okay.
Now, one of the key things about documentation and accountability is measuring outcomes. What's the best way to do that? Is there one best way?
No.
Okay.
There are lots of ways to measure outcomes, and really it depends on the situation. There are the short-term outcomes, which is if you measure evaluation of understanding, then you know they got it, at least initially. And if you don't measure it, there's no way to know. So the short-term evaluation of understanding is really important. If they don't understand it, it's important to present it in a different way so that they can. Now, understanding information is not the same as applying it. So the only way you can tell if they applied the information and it worked is if you look at long-term outcomes. And that could be the standard things that you hear about in terms of readmissions or improvements in measures of like A1C, things that you know are outcomes, no infections, no fevers, no readmissions, things like that.
Yeah. Fundamentally, were they able to take care of themselves once they left? Did they learn enough to be able to do that? And that makes sense. And in documentation, is there a way to comment and say, patient was able to teach back so and so, patient clearly understands, or is it based upon the documenter to put the words in there properly, or is it one of check boxes and check marks?
Our hospital has check boxes.
Okay.
So they have the topic on the side, and then you just check whether or not they understood it a little bit, a lot, not at all, and if they were able to solve a presented problem, because there might be problems that they have to deal with. Okay.
Our last question of the day: how do you make it so that patient education as an effort becomes part of the hospital's culture or mission rather than the program du jour, if you know what I mean?
There are a lot of quick fixes that disappear into the night. Basically, if you think patient education is important, which I can't imagine anyone rationalizing that it's not, you need to set up the infrastructure so it supports patient education long term. And then the biggest issue is administrative support and holding people accountable.
Yeah.
If it's in their performance reviews and you check to see if they're doing it and whether or not they get a raise, depends on whether or not they're doing patient education, you got a better chance of making it become part of the culture.
Yeah, I think that the last couple of things you talked about, if you don't have support from administration, if they don't care about it, then the message is that why should I care about it? And making sure that they care about it means that they support it, they fund it, And it becomes part of overall job performance. That
Yes.
makes it part of the culture then. That makes sense to me. Okay, cool. Well, this has been a very interesting topic today, one that I think we should probably explore again here in another few episodes, because there's some interesting details that we can go in. And we didn't cover the entire article, so I would encourage everyone to click the link in the show notes and read the article, or just go to Fran's blog, which is at notimetoteach.com, and look back in her archives at January the 4th. That's when she published this. So, Fran, I want to thank you for your time today. Why don't you tell folks how they can get a hold of you?
Well, I'm on Twitter every day at No Time to Teach.
Okay, and your blog's at notimetoteach.com, and you also hang out periodically on Facebook and Google+, because I see you there.
I do.
Now, I want to point out that your book is available anywhere where books are sold. It's available both as an electronic book and also as a traditional paperback book. And for hospitals out there, if you want to give your nurses some really practical advice, this book would be a wonderful gift for them. You can get up to a 40% discount directly from the publisher, and that's Pritchett and Hull, and they're available at p-h.com for bulk purchases. And I want to point out that the Patient Educators Update is brought to you by Synergy Broadcast and our Video on Demand system, MMDS, or Medical Media Delivery System, where we try to find ways to provide make it easy for nurses to deliver video education in addition to some of the other things that they have to do. So, Fran, thanks so much for this week. I will talk to you in another week. Take care.
You too. Thanks, Chuck.